This is a beautiful 50-year-old patient of mine who underwent lower face and neck lift surgery. She had significant swelling underneath her chin, as you can see, at 1 week and 2 weeks post-op. And we recommended a therapy that's become quite popular in my patients called Manual Lymphatic Drainage. You may have heard a couple of surgeons online talking about manual lymphatic drainage happening behind me after facelift surgery. Here are the 5 most common questions I get asked about MLD in my practice. Number 1, the most common being, of course, do I actually need it? And the answer is quite simple. It depends. Really, if you have swelling underneath your chin or underneath your eyes that is preventing you from reintegrating back into society, or if we're worried that the skin will not redrape on top of the framework that we've created, then we may recommend MLD to decrease swelling, then to prevent fibrosis underneath your skin. Number 2 is this new? And the answer is no. It's been around since the 1930s, but it's been repopularized in cosmetic surgery since about the early 2000s. Number 3 is, how does it work? Well, we're actually not quite sure. We think that it works to increase the blood circulation on the arterial side, to increase blood flow. It helps to decrease venous return and help lymphatic drainage. And we know that the lymphatic drainage of the face actually changes based off of the type of surgery that you do. So typically, the lymphatic drainage goes from central to lateral. However, with facelift surgery, because the flaps are lifted over here and everything remains intact medially, it tends to drain more medially. So the goal is to try to get it to go back through those natural lateral lymphatic channels. This can be disrupted, however, if you do medially based surgery like a rhinoplasty or lower eyelid surgery at the same time. The 4th most common question we get is, can it cause harm? And the answer is very clearly yes. If it's not done properly, it can actually create more inflammatory fluid underneath the skin, potentially leading to a collection or even an infection if done too early or inappropriately. And then finally, people will very commonly ask, of course, does it work? Well, I'll let you be the judge of that.